very welcome to my very favorite place in the whole wide world, every Friday or every other Friday on Omega Live TV. You are on Let's Talk About Health, and tonight promises to be an amazing session. I just want to say a big thank you to Omega House Multimedia and to Omega Live TV and to World Remit, who are our main sponsors for the show. Tonight I have a guest here, and you know I always like the patient account, the patient experience. So it's going to be a fascinating evening. Before I get the ball rolling, let me acknowledge those of you who are backing Let's Talk About Health, and I would like to say thank you to Grace Insona and Alice Wood Thompson. I realized you were doing watch parties on my behalf the last show. The last time we were here 2 weeks ago, I had Dr. Robert Khan on the show, and we looked at hypertension and hypertension in pregnancy. And I had amazing feedback on that show. So many of you messaged me to say you have actually acquired blood pressure monitoring machines, and I think that's a wonderful thing to do. Tonight we will be looking at another very important topic, lupus. And I have a patient here, but she was actually my senior in school, Infantsman Girls Secondary School back home in Ghana. So you will be doing yourself a disservice if you miss this session. I want you to start watch parties. I want you to like her page, Omega House Multimedia, Omega Live TV. I want you to do all you can. Get your family, get your friends on board, and join me. I'm your host, Mrs. Winnie Ohene-Kissi. And I welcome you all live on Facebook and on YouTube. I will let my host introduce herself, but before she does that, thank you, Dr. Robert Khan. I think you were awesome as always. And I think you are hoping to join us on this session as well, if time permits you. So please introduce yourself, madam. Let us know what your name is and what you've been doing so far.
My name is Amma Folson. I'm from Ghana. I've lived in the UK for a very long time. I used to work as a PA. I worked for the NHS and a big trade union.
A PA?
Yes.
A personal assistant?
Personal assistant.
Because in the medical field we have other physician assistants, so okay. I just wanted that to come out clear.
Personal assistant, right? Doing administrative work. But I also trained as a teacher, though I didn't practice.
Okay.
I'm currently retired, and I'm retired because of ill health grounds. And today I'm here to share my story as a lupus patient, and I want to share the experiences so that people will learn from it and they can also manage their health if they have this problem.
Absolutely. That is really wonderful, Sister Amma. And I remember talking to you and you managed to watch the show on dialysis and when you had the kidney patient here.
Yes.
And you said, yeah, this is the way to go.
Yes.
So tonight I am over the moon that eventually we've made this happen. So you are very welcome. I hope you are comfortable. And I know people are joining in and they are going to have a fantastic session. Let me acknowledge a few people who have been helping me along the night. Tonight I'm remembering my Folsa mates, Vijay Secondary School mates, Emmanuel Stevens, Emmanuel Kakupom, Douglas Texan, Catherine Savage, Linda Boache, Caritha Boache, and Lydia Enyan. Thank you. You guys are backing me 100%, so I really appreciate you. Doreen Owusupanahene, Fred Sasu, Angela Amano, Joe Aite, Crispina Doko. You were all my mates back in Services Primary School. I appreciate all you do for sharing and doing whatever you can to let this program go far. I'm also acknowledging Morgans. I'm sure tonight they are really, really watching. Infantsman Old Girls Association, I really like the fact that you are joining me and supporting me. Tonight is 2 Morgans here, so it's going to be amazing. Ama Ejibampa, Harriet Minta, Ama Fusua Fache, Letitia Mbro, Gloria Ellis, Constance Hayford. Constance, I know you are my cheerleader back in the US. Thank you so much. And then Mansa Johnson, Sami and Jackie Adebi Ankra, Willie Bassau, you are members of RAN. Thank you very much. Now, the topic, we will set the ball rolling now. Lupus, how did it all start?
Well, somewhere in my 20s, I started getting ill. Maybe joint pain, fatigue. I didn't think anything about it because I was young, leading my life.
In your 20s?
Yes.
Right.
I would say late 20s. Okay. So I was just working, enjoying my London life, going to parties, doing everything any 28-year-old person would do. So I think in 1992 what happened was I got very ill. But I'm not sure whether they told me I had that, but they couldn't tell what was it. I was admitted into hospital and then I recovered. Then I had a rash on the back of my palm and around my neck.
Right.
The rash must have lasted almost 2 years. I didn't understand it. It looked like a ringworm.
Right.
But it kept bothering me. And I kept persisting with my GP. And somehow he said he would refer me to somebody. I was referred, and I don't know, this lady kept seeing me, and somehow she said she wanted to do a special test on me. I don't know why.
So that's the GP?
This is the specialist.
The specialist.
Yes, okay. I was referred. I didn't even know whether it was a rheumatologist or anything.
Right.
All I know is I was referred. And this lady decided to do some blood tests, and I remember doing some odd 24-hour urine test, which I didn't quite understand. And then later, I also used to have a lot of hip problem.
Right.
So
by hip problem, what exactly
hip
do you mean?
Pain in my hip, pain in my joints. And then sometimes I'll have a fever like malaria, but not so, not having the temperature and all that. I didn't understand. And it will happen a few days, I'll feel better, I'll rest, and I didn't think anything about it. So I think I got a letter to go back to the clinic, and the lady told me I had lupus. I just laughed because I didn't understand what she was talking about. I didn't even know. They gave you a pamphlet to read about it, and she told me that because I have this disease, which is an autoimmune disease, I now have to come for review every few months.
So you had never heard of this condition?
Never ever heard of it.
I think a lot of people, even in this day and age, have not heard about lupus or know very little about lupus, be it even medical personnel. We would have heard the name, but in terms of what exactly happens, most of us wouldn't know too much about it unless you are actually in that specialty. And that is why I was so keen to listen to the patient accounts, because I think a lot of us underestimate this condition. So what exactly happened after that?
So after that, I was in denial. For a start, I just thought, well, I'm healthy. They say I have lupus. I don't identify myself with all the symptoms they are talking about in the paper. So I think in the first 2 years, I don't think I took it seriously. Then I think I had to move somewhere, so I found a different doctor, a specialist. I was now being looked after by a rheumatologist. When you have lupus, you have to be looked after by a rheumatologist,
right?
Because they specialize in lupus, which is an autoimmune disease. So I got referred to another doctor in central London, and I thought, I'm sure they're going to do this test and I won't have lupus. So when I went this time and they said I had it, I accepted it. And I started having symptoms, fatigue, swelling joints. One of the symptoms you have is skin rash, which I was very lucky in that I didn't get the typical facial skin rash.
Right.
And I was very happy about it. Not that I'm vain or anything, but the rash can actually destroy your face.
Yeah.
So I just carried on. If I have too much pain, sometimes I couldn't even walk. But I didn't understand. I still wasn't attributing it to the disease. I don't know whether I was in denial for a long time. But this time I had started taking all the medication they gave me, because as soon as you are diagnosed, you will be put on hydroxychloroquine,
Right.
So I started taking hydroxychloroquine maybe from 1996.
Right. Okay.
And then you get very tired. Tired, which...
For doing nothing, as in
which,
without any activity whatsoever.
Yes, and it's the kind of fatigue that no matter how long you sleep, you don't become refreshed.
Wow.
You know, you can sleep hours and hours. And then there's the pain, chronic pain. And what makes lupus even strange is you could feel well maybe Monday, Tuesday, Wednesday. And by Thursday, you're just flat. You don't understand what's happening to you. Sometimes it feels like somebody's knocking you down or beating you. You just do not have energy. You're in so much pain.
Yeah.
And for a long time, it went on like that.
Well, for the purpose of this show, because I mean, those of you who follow the program religiously would know that my background is not a rheumatologist or in that department at all. But I always like to read about the subject. So for purposes of study, the name, it's lupus, I understand means wolf.
Yes.
And I think it's in Latin or...
Yes.
Yeah, means wolf. And the long technical name is systemic lupus erythematosus or something like that.
That is
Very
it.
long, big word.
Yes.
So I try to break it down just so I have an understanding, because I think it is very important people understand the topic very well. So systemic, and I realize that it's actually attacking every system, you know, cardiovascular, renal, every system in the body. And then the lupus, actually the wolf, is actually the significance for the rash that you have, which is usually on your face.
Yes.
Yeah, and it's like a wolf bite.
Yeah.
I learned, and that caught my interest, and I was really keen to know more and more. And then obviously the erythematosus is just the rash. The nature of the rash is just a red rash, which usually comes across your face, around here, in between the bridge of your nose and, you know, like below your eyelids and all that. And so it really does deal with your system. So all you've been talking about so far is your symptoms, isn't it?
Yes.
Yeah. So any other symptoms that you had?
Like you said, being an autoimmune disease, lupus actually fights against you. It fights to destroy your organs, and lupus attacks your brain, your heart, your lungs, and your kidneys. I mean, for about 16 years, I would say I had a very mild form of lupus. And the reason why I say that is I eventually had major crisis.
Right.
Now, in the 16 years, it was basically joint pain. I did have some lung pain, which is known as pleurisy, where when you take a deep breath, you actually feel a lot of sharp pain in your ribs. And it's very uncomfortable. And what happens is, if you are on some medications, what they do is, namely steroids, they would increase it to treat it so that it can subside. So that was the main thing I had in the first 16 years. In my first 16 years, it was just my joint, it was fatigue, it was pain, and it was pleurisy in my lungs.
Right, and the same sort of symptoms
they keep repeating. And it's just like a cycle. Sometimes you will feel so ill, you will go for tests, and you won't have your results matching to your symptoms.
Right.
So you can have symptoms and it still doesn't match with your blood, but you still have the condition.
Right. Okay.
And the important fact that I have to say is lupus is not curable.
Okay.
It's an incurable disease, and it's a chronic disease. Lupus normally affects women, and it tends to affect more black women.
Right.
I don't know why, but that's the statistics. Also, it often affects people between teenagers and almost 40. And it's sometimes, they say, caused by a viral infection. Sometimes it's puberty. But they don't particularly know what really causes it. It is not contagious, and I don't believe it's hereditary, though there might be families that might have it, but it's not contagious. Neither is it hereditary.
So physiologically, from my reading, I found, just so people understand what is actually going on in the body, I think you've mentioned about being like your immune system being suppressed.
Yes.
Yeah. And what I read was the immune system itself, like your body's fighting, normally your body fights infection, isn't it?
Yes, but
it helps you fight infection. But in this case, the body cells, the immune system is fighting itself.
Yes.
Yeah, and that's
so
what
it's
makes
a war against yourself. Yes.
Yeah.
So it's really a losing game.
Wow.
That's how I see it. I think lupus is one of the worst autoimmune diseases.
Yeah. Because they term it as like a very good imitator, isn't it?
And it mimics so many diseases. It takes a long time before it's diagnosed. I mean, I was very grateful when I was diagnosed, even though I was in denial.
Right. So in your own case, from the time when you had the symptoms to the time when you had a diagnosis, how long did it take?
I would probably say maybe 2 years. And the reason why it was 2 years is I'm generally a person who persists things. If I have a health problem, I don't actually let it lie. I always pursue it because I really want to know what's going on.
Yeah.
And I think it's worked in my favor because I've actually had lupus for 27 years.
Wow.
And I believe if you are very cautious and careful, you can manage it.
Yeah.
It's a condition that can be managed.
It can be managed. Right. So how have you been managing up till this point?
I would say, first of all, I'm very grateful I'm in the UK.
Yeah.
I am grateful for the NHS because I have amazing doctors, I have the best medicine, and I have the best care. So it's one of the things that has really helped me.
Yeah.
I also take a great interest in the illness in that I am well informed about it.
Absolutely, yeah.
And the other thing is you have to study your body. You have to listen to your body because your body talks to you.
Perfect. And I keep saying that on the show.
There is no way you can be so ill and not know. It's impossible.
Yeah.
And I just know it when I'm not well. I say this because the many times that I've had crisis and been in hospital, sometimes the doctors even ask me, how did you get here at this time? Because it is so critical that if I didn't make it at that time, it could have been worse. So I know that you've got to pay attention to your symptoms, you've got to respond, and you also have to learn to express and articulate what's happening to you. If you don't say exactly what's happening to you, you really wouldn't get the, diagnosis and the treatment you need to, because it's a disease that fluctuates. So you should be able to tell your practitioners what is really going on.
What's going on.
So as I was saying about the disease fighting you, apart from my lungs being attacked, I've also had lupus attack my heart.
Right.
It attacked
So the first organ to attack
was my heart.
Was your heart?
Yes. After 16 years of being, let's say, stable, I would say it was like mild to moderate symptoms. I then had my first major crisis in 2009.
Right.
Which was about 16 years after. It was one afternoon, and the reason why I remember this is it was the week that Michael Jackson died.
Okay.
And I had gone for lunch with my boss at the time. And as we were coming back, for some unknown reason, I could not talk. I didn't understand it. I was like, what's happening to me? I could not talk.
After the meal?
Yes. We were walking back to the office. And I told her, no, this is not normal. I don't think I'm okay. And I just said, I need to end the day. I need to go to emergency. And she said,
right.
All right, no problem.
That's how bad it was.
Yes. So luckily I was in central London, and the hospital I attend was very close by. I was in St. Mary's Hospital, and I went to UCLH,
right.
which is where I have my treatment. So I took a taxi and went. Unfortunately for me, I was admitted the same day, and I was there for 3 weeks. And they told me my heart had been inflamed, and I had something called myocarditis. I don't know how I can explain what myocarditis is.
I mean, from a cardiac point of view, because that's my specialty, it's just the inflammation of the muscles, like one of the muscles that form the heart walls. That's what myocarditis is. It's just a bad inflammation.
Yes.
Yeah, but obviously because of the function of the heart, anything that goes wrong with the heart can cause you major problems. So that would have been a very serious condition.
Yeah. I believe it was serious because what happened was I was in hospital for 3 weeks. I was on very strong steroids.
Okay.
I can't remember the other drugs, but I know I was there for 3 weeks. And it was the first time I'd been admitted for a long time, and I didn't quite understand it. But also, what made me realize it was serious was that I was unable to go to work for 6 months. I was told to stay home till I was completely well.
After the discharge?
Yes.
From hospital.
And, you know, a few restrictions were put in place for me.
Like?
Maybe no heavy work and carrying things, you know, but basically to relax. So I did what I could do. And that was just that bit. Then subsequently, the year after, 2010 and 2011, I had acute kidney failure.
Wow.
And I say acute because I think I had like an infection, and for some reason I had a few issues. I went to the hospital and they said I had acute kidney failure. I didn't think anything about it at the time. I don't know why I didn't pay attention to the way lupus was attacking the body. You know, because I was living a fairly normal life,
right,
despite my struggles, because I'm sort of like, was acting like a steel person, not pretending, but I was living my life normally.
Yeah.
So what I did was, if I got ill, I would just do exactly what I was told. I didn't think this would lead to lupus nephritis.
Right.
What I didn't know was that because my immunity was low, you catch a lot of infections.
Very easily, isn't it?
So easily, because you have no immunity. And so for every acute kidney failure I had, my kidney function was reducing without me being aware. And I didn't put my eye on the ball. So suddenly, fast forward to 2012, I then got another attack of another organ, which was my kidney.
Wow.
And I was diagnosed with lupus nephritis, a kidney disease stage 4.
Stage 4 kidney disease. Right, okay. Wow. Wow, that's overwhelming. Anyway, if you've just joined me, I've got Miss Amma Folsin.
Yes.
You still use Amma Folsin, isn't
Yes.
it? Yeah. Here with me in the studio. You are all welcome. Thanks for joining us live on Facebook and on YouTube. We are live through Omega Live TV. Like our page, share, keep sharing so we can get more and more people to join in, to listen to this, amazing account of somebody living with lupus. And so far we've been looking at how it all started, how it's gradually attacking organ by organ, and that is what lupus actually does. And we know some people have very mild symptoms, isn't it? So you would even consider joint pains, fatigue as just mild symptoms of the disease. But then it gets serious with time, and we will take time and go to that. This is coming to you by kind courtesy of World Remit. World Remit, if you want to send money to your friends and family back home, especially back home in Ghana, you are very, very safe using the services of World remit. So we will go back and continue. Now it's affected your kidneys now.
Yeah.
Yeah. Did it go on to affect any other organs?
Well, I don't even know to say whether I'm lucky, but it normally affects the brain, the lungs.
I think we have some pictures. If the producer can put it on the screen for us.
The brain, the lungs, the kidneys, and your skin. So the main four things: your heart, your brain, your kidneys, and your lungs. And I believe I've escaped the brain.
Right.
But I've had everything else.
You've had everything else.
Yes.
Wow. Yeah. You know, I looked at all the information that you sent me, and I was just blown away. The sheer volume of, like what the disease does to your body. And I was quite thrilled with this particular diagram. Can you tell us what is going on with this particular diagram, please?
Now, I can see myself in this. You see the bit about photosensitivity.
Photosensitivity, yeah, on the left arm, isn't it? But the right side of the screen.
Yes. I had that this morning.
You did?
Last night I slept and I was okay, and I could just feel my eye was hurting me, and I was like, why am I having this problem? And I woke up. I could hardly open my eye.
Right.
To treat it, when you go into sunlight, you become sensitive, and it affects your eyes, and you can get inflammation of the eye.
Really?
So it's one of the things, and you have a lot of inflammation. As you can see, the lung...
So prior to this morning, had you ever had photosensitivity?
Oh yes, I have had photosensitivity. As lupus patients, you're not supposed to sit in sunlight.
Okay.
It's one of the things you shouldn't do.
You shouldn't do?
No.
Right.
Because it aggravates the condition.
Okay.
And then that's how you get photosensitivity. You get joint pain, which I've had. You get nerve damage.
Right.
These are the symptoms you have. I've had the heart damage. I've had the lupus pleurisy.
Yeah.
Now, lupus affects pregnancy, as you can see in the tummy bit. And the reason why it affects pregnancy is many people who have lupus tend to have multiple miscarriages.
Right.
It is advised that if you have lupus as a young lady, you consult with your doctors so that they can find a safe way to help you if you really want to have children.
Right.
But normally, if they can, they would advise you not to, because you do get a lot of flare-ups with pregnancy.
Right.
Yes. And then you get neuropathy as well. These are all symptoms. And then you get kidney disease. I'm not sure about the liver, but you often have a flare-up is when you have the disease active.
Yeah.
And sometimes you have remission. And so that's when you have a fluctuation. And sometimes people are deceived thinking that they've been cured. But you can even have remission for 5 years and you're still a patient.
Wow, really?
I mean, yes. And these are the main organs that are really affected by lupus. You get pleurisy, which goes with breathing. And you get pain, inflammation in your chest. And then the brain, it can affect your central nervous system. Even though I've been feeling dizzy, I don't think I will attribute it to lupus. I don't know whether it's denial, but I have not been treated by my rheumatologist. So it's not something I believe I have. But I've been treated for my lungs, I've been treated for my heart, and I've been treated for my kidneys. And I'm currently being treated for the kidneys. For my personal case, lupus has damaged my kidneys. It's the worst thing that has happened to me.
Right.
And these are the day-to-day problems you have. I mean, I have very severe insomnia. You have, and you will always be stiff in the morning, because when you sleep and you wake up, you're tight. It's very difficult to move around. You tend to feel cold and extreme fatigue. Weight gain, I don't know whether it's because of the steroids, because steroids will make you put on weight. I mean, I've been on steroids for well over 12 years. So
you don't look bad at all, actually. So you don't have to worry about that. You're doing really well.
And you do get chronic headaches as well. Strangely, I have only started having irritable bowel syndrome.
Okay.
It only started about 3 or 4 months ago.
Right.
So it's a pretty serious. Imagine having to deal with this on a day-to-day basis. And what makes lupus painful is, for me, I can't remember ever time not being in pain.
Wow.
I cannot remember a time that I've never been in pain.
You see, the reason why I was so happy you wanted to come and talk to us about it is, you know, that when I get the guests here and they are professionals, it's a different thing. It's like when we were in school and we had we did topics in theory, and then occasionally you have the chance to do practicals. You know, getting a patient's account is like the practical side of things, because the patient knows their body and they are the ones going through it. So there is nothing more insightful than to have a patient giving an account of how they are dealing with disease. I mean, you had this condition when you were very young, like in your 20s, and you've been amazing to manage yourself. I will say manage because we know it never goes away and it can't be cured. So you must have been doing something really well. Can you just give us an insight of like how your day, your normal day is like, even in terms of medication alone?
Oh, okay. One of the things you have to take seriously with lupus is your medication, because it helps you a lot. First of all, the hydroxychloroquine, I believe, is given to you for fatigue. It's supposed to alleviate it, but it doesn't mean that you will never get tired. It's what they use to treat. So initially, I was on hydroxychloroquine and some painkillers, diclofenac and cocodamol. So those were my core tablets, just the 3 tablets I was taking. However, anytime you get a flare, depending on the flare, they would give you steroids, basically prednisolone.
Okay, so the steroids are not given, like you don't take that continuously?
You would take that continuously, but it is when the disease has really established itself. Initially, in the first few years, I would get steroids injections or steroids tablets for a flare.
Right.
But when they were sure that I was having it, I then had steroids, a minimum dose, a maintenance dose.
Right.
So I carried on having that. So I kept taking hydroxychloroquine and cocodamol and the others for a start. But what dramatically changed my medication was kidney disease. By virtue of getting kidney disease, I automatically got high blood pressure.
Right.
So now I'm not dealing with one disease. I'm dealing with lupus. I'm dealing with kidney failure, and I'm dealing with high blood pressure. And immediately I went from 3 tablets to about 18 tablets a day.
Wow, a day.
Yes. And the way I keep on top of my medication is I set timers on my phone, because as you can see, this is
if we can hold this and look at the screen.
This is these drugs are just drugs for 4 weeks, and they are for 4 weeks because I love Ghana and I go to Ghana very often.
So this was set for holiday.
My holiday drugs for a 4-week trip last year.
Right.
Now, the one on the right is supposed to be something called a Dorset pack or a Blizzard pack. Now, my drugs are organized in, because they are so complicated, and in order not to forget, they are arranged in a certain way so that I can take it. I can actually show you what it looks like.
So that is just what is on the right side of
the screen.
That is
just the right side on the screen. And these are my core medications. When I say core, they are what I have to take every day.
You cannot miss those.
No. And sorry, I'll just try and open this if I can.
If you can have the producer project onto the blister pack.
So this is a blister pack. and it has all my medicines for a week. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Now this is the morning, this is mid-afternoon, early evening, and bedtime. Right. And on the sheet it tells me exactly what it is. Yes. So let's say if someone was with me and I wasn't well and I wanted them to help me, they will know exactly what I take.
And at what time.
And these core tablets do not include things like my prednisolone, which is a immunosuppressant. I have about an injection that is not here because it has to be kept in the fridge. I take that every 2 weeks, and that's mycophenolate. And I have eye drops. The thing about lupus is most lupus patients have another autoimmune disease, sadly. Some people have either fibromyalgia. In my case, I have something called Sjögren's syndrome. And unfortunately for me, it affects my eyes, dry mouth, and so I have a lot of eye drops, I have to say. I also have to take sleeping tablets because of the insomnia. Insomnia is so bad, I can go 3 to 4 days of not sleeping. So all my medications put together, it's about 20 a day.
Wow.
In that blessed pack, plus the ones that you have to take when other things are going on.
Wow. And this is just the collection for a 4
This is just
holiday, for
4 weeks tablets.
Wow. That's a lot to take in. I looked at this when you sent it to me. I thought, oh my God, that's a lot of medication, and you need to know each and every one of them. Yes. Would you say that the medications were what triggered the kidney failure?
No.
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 It's just part of the disease process.
It is not the medication that triggers the kidney failure, because lupus attacks your organs. So it's the disease, it's the lupus that actually caused my kidney failure, and that's why I have it.
Wow. Anyway, we'll take a little break, so just get ready, and then you tell us how life has been, because you must be doing something right to be, to keep going and to be looking after yourself and looking so amazing. By the way, Sister Amma was my senior, so I like to maintain that, my senior at Ofantuman. So I'm so happy you are here. And what an insight into this condition. I know a lot of people wanted to join in to ask questions, and also if I can actually link up with them. But all this is coming to you by courtesy of Omega House Multimedia, Omega Live TV, and we are sponsored proudly by World Remit. World Remit, fantastic service if you want to send money to your friends and family back home. And we've been having an amazing session looking into lupus, and we have Sister Amma Folsom here, and she's telling us how she's been living with lupus from when she was only in her 20s. And now I guess you are my sister's mate, is it?
Yes.
So you must be in your mid-50s.
Definitely.
Thereabout.
Definitely.
So you must be certainly doing something right. How has it affected you generally? Like life generally?
First of all, I'm a very positive person.
Good.
So the fact that I was told about this disease didn't mean I was going to curl into a corner and cry or anything like that. No. I just decided, as long as I do the things I want, I will take a break when I'm not well. You have to be very active and try and live your life as normal as you can. Obviously, in my 20s, I worked, I went to parties. And one thing about this disease is you really have to be active. If you do moderate exercises, I wouldn't even say I was so serious about my nutrition as I am today, but I feel my mental state has been what has helped me, because I just go with, I woke up, I'll take my medicine. If I have to go to work, I'll go to work. If I have to go out, I'll go out. The only time I always took a break was when the disease actually knocked me down flat.
Right.
But once I have recovered, I try to just lead a normal life, you know, and I know a lot of people are scared of drugs, but I have not had that problem in my life. I understand the medicines I'm taking. So I just take them and carry on. I would also say that relationships, the kind of relationships you have in your life would contribute to your well-being. I'm blessed to have fantastic relationships.
Yeah.
I have a strong family bond. I don't have any family member in the UK. I have maybe some first cousins, but my mother, my siblings are in Ghana and in America.
Right.
I get a lot of my strength from my mother. My mom is a tough cookie.
Wow.
And it's all about you make the best of life, whatever it is, you know. So my friends in the UK are like family members. They are supportive, you know, and I think I have a natural way where I've set some boundaries. People don't infringe on me in terms of like, they don't put pressure on me to do what I don't want to do. Because you know, when you have this disease, I feel as a young person, let's say if you were lying in bed and you weren't well, you might get some pressure from people. Oh, you're lazy. Oh, you're this. But no. I mean, I make it clear to the people around me that this is my condition. This is what I can do. And they accept me for who I am. So it's been very helpful. And I've had support from Morgan's. I've had support from Hobson's, you know. I've really had very good support from my relationships.
Yeah. It looks like we have a lot of people joining in. So let's acknowledge them and see if we have questions for you as well. So I'll start from the top. There are over 80 people live at any particular time. So Jennifer Mantiao, Stephen Tufo, Philo Chumesi, Dr. Robert Khan is tuning in because he's going to support in case there are any technical questions. And I think he's got a contribution, so I'll bring that in as well. Pa Mensa, my chief cheerleader. Hello, Pa. Thanks for joining in. Lydia Kwashi is also another cheerleader of mine. Dr. Robert Khan is saying, quite commonly, the symptoms are vague, but if you are having the following symptoms persistently, seek advice. And he goes to suggest that if you are having fatigue, joint pain, skin rash, weight loss, headaches, dry eyes, dry mouth, and feeling unwell persistently, do seek advice. More people also, the pleuritic chest pains are also quite common, he said. And Charles Quist is saying the cause is idiopathic. You have to break that down, Charles. Idiopathic, break that down and I'll get back to it. Dr. Khan says, thanks, Amma, for emphasizing the need to be interested in our illness, you know, like knowing yourself, to be interested in it and being well informed about what affects you as a person. Adelaide Amma Bonio Swachem Irabama, you are such a fighter. She must be someone you know very well. Ekuya Mamiekwa Anderson Bailey, proud of you, Sister Amma. Baba Taki, good job, says Jackie Nana Ekuya Daba. And she says, and you still live your life, my dear. You are an inspiration. You see, and that is why it is very important, because like us as Africans, we do not want to disclose to anyone about what condition we are going through, and so we will not get the support. You know, and we look down on so many things. Everything is a stigma. So people simply don't want to share what they are going through at all. Letitia Arthur says, wow, watching you live from Ghana. Thank you. Christina Jeriafe, Ama, you are an inspiration. Yeah, she really is. Lakeri Na Bude, well done and thank you for sharing. Do you know this person? Benny Hannah, Ama, you are very brave and an inspiration to us all. Mary Wilmot Badin, Sister Mary, thanks for coming this time too. Very informative. And Dr. Robert Khan says autoimmune diseases can attack any organ system in the body: eyes, ears, thyroid, heart, lungs, blood cells, blood vessels, kidney, liver, skin, adrenal. So it just simply attacks everything in your body. Letitia Arthur, very educative. I'm thrilled by how informed the patient is, and this is why the patient account to me as a health professional is absolutely important, because like I said, theory is different, but when you live with it, it only takes, you become a genius almost, like pretty much in your field, just by knowing and dealing with your condition. And you would be surprised how many people will be inspired by this. So Jackie Nana Ekwiadaba, very informative, Ama, and we shouldn't forget the kidney appeal. We should not forget that, because we will have to do that and finish off with that. Dr. Khan again says lupus can cause hepatitis, as the disease can cause liver inflammation. It can attack pretty much everything. Ade Kote, Jane Halm, Quagrin, Jackie Nana Ekwiadaba says mostly steroids can lead to the weight gain. I think we did mention that earlier. Millicent Ayedan Kwakumsen, very informative. And Dr. Khan really is impressed with the amazing account. So we will keep going. Joyce Hagan Eduhene, thanks a lot, Amma, for enlightening us on lupus. That is not enough. Just like our page, share, keep sharing Omega Live TV. Get your friends and family involved. I did have a few people call me from Ghana through Messenger to say they are really looking forward to it. It's not enough to keep this to yourself. Keep sharing, keep liking, and let's get more and more people to get the knowledge out there. You'll be surprised how many people will be saving doing this. Christine Ajeriafi says, replying to Jackie Diaba, very true. I think it's something we mentioned earlier. Moga all the way, Obranye, Warabo, yeah, we love you all too. Deborah Sebwache, Ama, I love your positivity. You are amazing. And sure, she is living her life no matter what. And Harriet Pettifer, astonishing accounts, very educational. Thanks for sharing, Winnie and Ama. I'll better watch it. Positivity is key. Positivity. And you remember the kidney patient, Mr. Jaja, hello, I hope you're watching this one too. He had the same kind of passion about the condition and had the same kind of inspiration, and a lot of people were moved by it. Letitia Arthur, great account, positive thinking. Call Otiba, thanks sis. Sister Amma, you are great, he said. Nathaniel Emisa, learning something today. Amma, God bless you. We are proud of you, according to Cynthia Arthur. So yeah, we will carry on with the session. So did this affect your family life? And in that regard, I mean in terms of like fertility or anything like that, did it affect?
I would say yes and no.
Right.
In general, I didn't marry early.
Right.
So I got married in my 40s.
Okay.
And the only time I tried, I miscarried. And it was painful, but I accepted it, you know, and I had read so much about it. Interestingly, recently I was speaking to one of my cousins who was a doctor, and she was shocked. She was like, you mean your doctors actually thought you could have a baby? I said, well, I tried. He said, well, normally if you've got lupus, you don't have to put yourself through that, because when I look at the crisis I've been through, I think it wouldn't have been easy with a child.
Right.
And I must say I'm very lucky to have a wonderful husband.
I know your husband is
who
amazing.
Is quite happy as we are, whether we have kids or
Fantastic.
not. So I'm just happy as it is.
Yeah.
But for any young person who really has lupus, who wants to have a child, you need to seriously look at it early and make sure you have that journey with your rheumatologist and the right obstetrician, because it's not an easy journey. I know it's very difficult.
It is.
I mean, people have told me of people who have had lupus and had children and subsequently died after.
Died after childbirth.
Yes.
Right.
So it's not really an easy thing.
I guess it's not easy, especially when you are African. It's going to be very difficult, isn't it? The way we attach so much importance to like having children and as against your own health, you know?
Wow. That's true. I think it can be difficult because, I mean, I don't know whether people are advised and they still go against what the doctors say.
Yeah.
But you also have to think about yourself, you know,
Yeah.
in terms of fertility. It's
Exactly.
not an easy journey because I'm sure general pregnancy can be quite difficult. So having an autoimmune disease with pregnancy, and the way autoimmune works, you never have one thing. When you have an autoimmune disease and you have a problem, you even have a ripple effect with other things happening.
Yeah, absolutely.
So I cannot speak on that because I haven't had that experience.
Right.
But I am aware of it.
You are aware of it.
Yes.
You did mention along the line that you've retired.
Yes.
And you had a lot of sickness issues, I would imagine. How was work life like? And did you have any support at all?
My work life was very interesting in that when I was diagnosed with lupus, I was temping. Initially, it was very difficult because it was tricky on when you should release that information to your employer, as in disclose whether you have this health problem or you don't have it. So what I did was initially I decided to temp because I wasn't confident in sharing this health problem with an employer. So I temped. But God being so good, the time that I was diagnosed, I was working with the best trade union. And they were the best employer I ever had. They were helpful, they were tolerant. There were times that I remember at that time, I took 2 trips to Ghana where I stayed 2-3 months. And they found people to cover me and I came back to the job.
Wow.
So they really supported me. Subsequent to that, when I was made redundant because there was a reshuffle with that organization, I decided to study. I went to do my first degree. I was 38 at Kingston. And imagine doing a degree as a mature student with a health condition.
Yeah.
But we're in the UK. You get all the support if you disclose. So, you know, because I have joint problem, even though my job was keyboard, in university, I couldn't write notes. So I used to record my notes. I also had a note taker who would take my notes for me. During exams, I go into a separate room. I dictate my answers and a scribe actually writes my answers. Wow. And this was all set up through the disability system in the school to support me. And so I was able to do my degree.
Did they give you more time then?
Oh, yes.
Okay.
It's things that exist. If you have an illness, a long-term illness in this country, don't let it stop you from pursuing a career, further education or anything.
Yeah.
There's always support. You just have to find the right people, have your doctors support your condition. And I was able to do 2 degrees between 2003 and 2015 and working at the same time. You know, I just never let anything faze me. If it's in my mind that I want to do it, I just went ahead and did it.
Fantastic.
You know? So after that, after my degree, I then was employed by the NHS. I was working as a personal assistant, but this was when I started having major crisis with the lupus. All the same, because I disclosed it during occupational health, I was supported. I mean, if I went and the doctor says, go off for 3 months, they would just let me go. And then when I come back, I would have, you know, when you have that staggered return? I would have
phased return.
Yes, phased return. And I was able to be in that job for 7 years. Strangely, I started at full time, but as I was getting ill, I had to now reduce my hours to, I went from 5 day a week to 4 day a week, and then to 3 day a week. And the reason why I did 3 day a week was, if I rested between Sunday and Monday, I had enough rest. I'd work on Tuesday and Wednesday, take a break on Thursday, and then go back to, because I needed the rest period. I was getting really tired. Then, imagine. When I had kidney disease, unfortunately for me, I started having a lot of spasms, spasms in my hand. One of the worst things I experienced when I had the kidney disease diagnosis was I could barely hold things. If I hold something, my fists will go into spasm.
Really?
There were times when I couldn't even hold a cutlery. So my husband would chop the food for me and then, he will feed me. But it now started affecting me because I was doing keyboard work. And an employer can do as much as adjustments as they can. It can get to the limit where they cannot do anymore. So in about 2013, I got ill and I could not perform anything. I just couldn't do anything. And the employers decided to negotiate, and I was told that I had to consider to leave the job.
Wow.
So I would say lupus does affect your career. I mean, no matter what, it will affect you because you're going to have a lot of sick. And I don't know how people would deal with it. I also know that you can actually lose your livelihood. I was forced into retirement at 55. I didn't want to, but at the same time, because I have accepted my condition, I knew I couldn't do it because I was virtually in pain and crying at work.
Wow.
You can't actually be so sick and be at work. I was heartbroken, but it's now 5 years down the line and I'm quite okay. I've adjusted.
Yeah.
However, the flip side and the good side of it is, since I lost that job, I have never been admitted into hospital.
Wow.
Because there was stress there.
There is stress.
There was stress there. I was working with the NHS. So for me, I would rather have a life.
Yeah.
And, I've worked. I've worked all my life. I worked for about 25 years. So, yes, it's sad that I retired early, but I know it's for a good reason. I can extend my life.
Yeah.
Even if I have an illness, I still can extend my life. So, my quality of life has improved because I don't have the pressure of work. I just have to take care of my health, which is now my full-time job, and I take my health seriously.
Yeah, seriously. So how were your colleagues like? How did they cope with all that? Because definitely
they were supportive. They were really pleasant. I mean, I know in the last days it was difficult for my land manager because for me, I think they wanted to give me a job which was, to me, in my opinion, a complete demotion. And for me, it was a demotion, and it was still going to be hard work. And I was still going to be in pain. So what was the option? The option was to really go. So I took that option. But I think they did their best because of the laws in this country. And I feel if it was a private firm, they would have probably let me go way ahead.
Yeah.
I remember looking at my departing notes.
Yeah.
And I was shocked that in the period of 7 years, my days of sickness were over 2,000.
Wow.
It was
2,000 days.
It was beyond me. And it made me realize that I was really ill, but I was just struggling. But I didn't know I was struggling. Because nobody really should have that sort of sick note.
Yeah.
But obviously, I knew what situation I was in. And I would say they helped me on because I was competent. Because why would somebody keep you on for about 7 years if you've got all these problems?
Yeah.
It's not only because they have to follow guidelines. Whilst I was there were times I used to go to work on crutches. My colleagues knew I was ill. Everybody knew it. It wasn't a hidden secret, and they supported me, I think.
Fantastic. I think we are getting to the latter stages of this discussion. And one thing that caught my attention and said, I am going to try and get Sister Amma on here, was the kidney appeal. Yes. Yeah. So just tell us, let's focus now on your kidneys and why that appeal.
Okay. So now lupus has completely destroyed my kidneys. Now kidney disease, we have stage 1, 2, 3, 4 and 5. I was diagnosed at stage 4, which is just before the last stage. Now,
and how many years ago was that?
I was diagnosed in 2012.
Right.
And in 2017, I got the letter that said, you are now in renal failure stage, which is the last stage. Now, from 27 till now, you are now then put in the clinic which deals with dialysis and transplants. Now, I'm on the border of stage 4 and 5.
Yeah.
And the way forward is the only way I can live is by either being on dialysis or having a transplant. Normally, you have a better chance in life if you have a transplant. But it is even better if you have a live donor.
Right.
That is somebody who is living like a relative or a friend who chooses to give you their kidney. And this is why about 6 months ago, I had a little video clip that went around appealing for a possible donor. The good news is I have a friend who has offered to give me his kidney.
Wonderful. Wow.
He has been going for, what do you call it, the workup.
Yeah.
But it does take a long time.
Right.
And this is why your monitoring in kidney clinics, they have a criteria. As your kidney function is dropping, they prepare you. In the UK, you have to reach a kidney function of almost 15% or EGFR 15. Once you hit there, if your quality of life is good, like my recent update was that for the 18 months I've been stable. Now, I've been stable because I've been working hard. As a kidney patient, you have to be on a strict diet.
Right.
There are so many things you are not allowed to eat. Mainly, you have to eat low potassium food.
Right.
Now, low potassium food is very hard for Ghanaians because you've got plantain, you've got yam, you've got cocoyam, you've got...
these ones you are mentioning are
high in potassium.
Right.
And avocado. I love all these things, but I want to live, so I don't eat them. Because if you eat them, you're going to have a high potassium, and that will give you a heart problem. And that could even affect your chances of even having dialysis or a transplant. So the way you can manage your kidney when you get to a certain stage, you have to be on a strict diet, which you follow what they call a renal diet, which is a kidney disease diet. And there's a list and there are things to follow. And apart from the diet, you also have to be on low salt. So if I don't have dialysis, I won't be able to function. Now, dialysis is not always the best choice, and it can weaken you.
You already started dialysis.
I haven't started dialysis.
Right.
But in the treatment line, I'm at the point that I either have to have dialysis or transplant. My consultants are working hard for me to get a transplant.
Straight away.
Yes.
Right.
However, being from the black and ethnic minority group, we are the group that have the least organs available. So
in the
UK, we tend to stay longer on the waiting list. It is the reason why they encourage you to find a live donor. At the time that I did my appeal, my friend hadn't offered. So once I did the appeal, she decided to come forward, and that's why they are doing the workup. Unfortunately, he's not a match. However, there are ways around it.
Okay.
Yes, so it is a process, but it takes a long time because you have to go through a whole lot of tests. So that's where I am, and that's why I was on that appeal, and I'm still on that appeal because we don't know the outcome of this potential donor.
Fantastic. You know, you mentioned about managing your potassium. I've had a kidney patient here before who has had dialysis. Mr. Jaja, hello. He's had dialysis, he's had transplant, he's had the whole lot. And he is also fantastic. I think you watched the show on him. And potassium always comes up, I was going to look at this from a cardiac point of view, and because there are so many times that people ask me and ask other professionals, do we take supplements, all the supplements, like all the different supplements that are on sale, vitamins, this, that, and always the answer is they want to be cautious because they do not know the clinical picture of the person that you are dealing with. So you will find a lot of us health professionals who are especially into acute care are always reluctant to give any information, as to take these supplements or take this concoction, that kind of thing, because they are from natural sources, like the foods we eat, for instance, isn't it? And like potassium is very important in how the heart works. You see, too high is not good, too low is not good. So we are always fighting, in trying to get in a fine balance. And what generally happens is there are chemical reactions going on in the blood or in the cells, and the potassium tries to move across the cells, not just potassium, we call them electrolytes, calcium, magnesium, and for somebody like you, yours will be strictly monitored, so that you are always having your electrolytes in a very good place, like in normal ranges. So if you go, for instance, on a routine check and your potassium is low, they would want to top it up. We are talking of fine margins, like the potassium range, for instance, is like 3.5 to 5, 5.1, 5.2. You go up, there is a problem. And as these electrolytes go across the cells, then it works on the heart muscles, and then it sort of improves contractility, how the heart contracts to pump blood round into circulation. So that is why we are so reluctant. But this always comes up, potassium. Every person who has a chronic condition will be told one thing or the other, especially when you are a patient like with lupus, with kidney failure. And that is why I'm always cautious when people ask, and they always do. And I had pharmacists here the other day, and they said, look, food supplements and all these things, they are good, but we don't know what we're dealing with. So all I will say out there is diet. I guess you are on a strict regime, isn't it?
Yes, I am.
For your diet. Yes. How is your diet like on a daily basis, like just on a normal day? What would you take?
First of all, I can have as a kidney patient, you can have all the bad things that people are not supposed to have. When I say bad things, you are allowed rice, you are allowed white bread.
Okay.
There are some fruits you can have, but basically very limited, like apples and peaches.
Apparently mango is a no-go.
No, it's a no-go. It's very restricted. You can have strawberries. You can have maybe fish and chicken. But everything has to be like little portions as well. The reason being, you're thinking of how the kidney filters your body. Because the more things you put in that are not the right thing, you will feel sick. You'll be nauseous.
Absolutely.
You'll be so uncomfortable. I mean, you won't really be yourself. So it's really good to actually do exactly that, what you've been told. But there's a lot of restriction. I mean, my diet is really boring.
Let's put it this way. What would you have for breakfast, for lunch, and for dinner, for instance?
Okay, egg whites.
Egg white.
Yes, meaning egg whites, no yolk. I would fry it. Well, for lunch, maybe I would have chicken and salad, and I can have rice. One thing that I can have is tomatoes. So, the Ghanaian stew? It's a no-no.
You can't have that?
No. So these days I have bell peppers and onions. I can stir fry that and add it to my chicken or whatever protein. And that's what I can do. But my diet is really boring.
You did mention to me when we had a discussion before coming that you soak potatoes.
Oh, yes.
And what was the reason for doing that?
If you are a kidney patient, depending on if you know your body well, if you want to eat potatoes or you want to eat yam, you have to skin it, soak it in water for about 4 to 5 hours, which is known as leaching. By virtue of doing that, it takes out a large amount of potassium. You throw it away, and then you put it in a pot, cook it in a lot of water, and you can do it. I can assure you, I've done it. I've gone for my blood test, and my potassium was perfect.
So you're still enjoying our local foods?
Yes, but not occasionally.
Occasionally,
very occasionally.
Wow.
You know, I love avocado pear. I would have maybe a 1/8 in maybe once a month or once every 2 months, because avocado is high in potassium. So you really have to restrict your diet.
You have to, and that is very important. And for those of us who are lucky enough not to be sick with anything at all, you must count yourself blessed. I know people have been giving me a lot of feedback on this show, and sometimes they say, oh, it's long and it's lengthy. I mean, the number of hours we use watching Netflix and all those other things, you know, spare a little bit of time and invest some time in listening to health programs as well. I think we as Africans are not really into reading much, and sometimes the priorities are misplaced, isn't it, when it comes to where our interests are. So if you have joined me live on Facebook and YouTube, we are with Miss Sister Amma Folsen, and Morgans are here, they are watching you. Let's take a few more feedback. Well done girl is from Jackie Nana Equia Daba. Andrew Chumesi is our pharmacist who was here about a month ago, says, great show as usual. Amma, I love your optimism. In spite of your condition, you are living life to the full. And that is really fantastic, and it's good to see. You deserve, Dr. Khan says, you deserve a break after all the work you've done. 25 years of work is an amazing contribution to society. So you have done your bit. In spite of all you have been through, you know, a lot of people would have packed their bags and baggage a long time and wouldn't even try. And someone is saying, well done, NHS. Barbara Christian, you are a strong woman. Great show. Stephen Tufor is one of our presenters here. And our host is looking very beautiful. Thank you very much. And this was given to me again by my best friend, Nana Sarah Amufa Pia. You always want me to look great, and I can tell. The little bit of the summer that is left, we have to make good use of it. Eunice Esel says, amazing. And Emma Martha Otu, bless you for the insight. Christina J, for excellent news. I think all the discussion. Adelaide Amma Boni Uswachem says, Amma, she has a question for you. You've clearly shown how important to seek help. How do you manage with your mental health or psychological well-being? That is a fantastic question, because I think we've looked at the physical side of things, isn't it? But sometimes the emotional, the psychological side of things is very important. How have you been managing that? And she says, mental or psychological well-being, despite your own resilience. And she is going on, she says, is there a support group that
yes, I need to mention.
I think there is someone she's actually talking about. Is there any time you've had to seek help, I think mental wise? And what about support for your hobby? Is there a support group that he accesses by phone or attends, or you both join and share your experiences? Is there any support groups?
Well, I am with a lot of 2 online support groups. The reason why I'm on this support group is they're all lupus patients.
And it's online, did you say? So people can really join in from wherever they are?
Oh yes, it's not restricted.
Okay.
I'm with a lupus online community, and I'm with a kidney disease online community.
Wow.
And it's fantastic because everybody there has the same problem. And I feel safe. It's a place where I get a lot of I would say assurance and relief, because I know I can't just talk to the ordinary person about what I'm going through for them to understand.
They won't understand your condition.
I do have 2 communities that I'm with.
All right. Do you want people to know these? So, especially because it's online.
I will have to give you the details.
Yeah, okay. So
I can't take
go
it from
on our Omega Life page. I will be posting details of these two support groups so you can have access to it.
Yes.
Rodlin Graham says, proud of you. I'm a great show. You show inner strength. Amazing husband too. I think we all know your husband is fantastic. And hello, hubby. I know you are also fantastic. So thank you for all the support you give me in doing this. And says, Winnie, thanks for the support too. Moga all the way. Thank you guys. Thanks for the support. Hannah Opokwa Emisa, very proud of you, says, Ama, you are incredibly brave, amazing and courageous. A true inspiration to us all. Dr. Khan says, Winnie, you are doing an amazing job helping us improve our strength. Thank you. I like your support, Dr. Khan, and thanks for the other show. If you missed my acknowledgement for the show 2 weeks ago, well done. Philochumesi says, Adriana Sare, it's very educative learning. She's learning so much. Jackie, keep going. Why? We spend more time socializing. Hobsons are watching too. Adrana Sari, thank you. Princess Rosab, God bless you for doing this wonderful job. Very insightful according to AC Yeboah Isel, and brilliant insight too. I think there's a lot of compliments coming this way. Dr. Sapia Kabukona Te Mamiekwa Anderson Bailey says thumbs up. IVJ Apia Mamiekwa, yeah. So we will keep going. And Betty Hammond, very informative. I think we are at the last stages of the session. So COVID would be a big thing for you.
Oh my goodness.
COVID-19 has been a challenge for anyone without any condition, let alone somebody living with lupus, which is an autoimmune disease. How have you coped through COVID?
COVID has been detrimental. And I say COVID has been detrimental because at the beginning of, just before quarantine, people who have complex health were bombarded with letters from the government and texts. First of all, I got a letter from my doctor that I'm extremely vulnerable. I got a letter from the government. I got a letter from the rheumatologist. And you were getting daily texts constantly. If you step out, you're going to die. This is going to happen to you.
Wow.
I was supposed to, apart from isolating you, remember the healthy people were allowed to go out for 1 hour a day. Our quarantine started with 12 weeks of not stepping out
of your house.
I wasn't even going to my front door.
Wow.
My husband was getting all the shopping, and if he could, he would go out. But I never stepped out in the 12 weeks. The only time I went was, one thing I forgot to say is the way lupus and kidney disease is monitored is through blood tests.
Right.
So you will have a lot of blood tests.
And how regularly are we talking about?
Very regularly. I've been poked more than
weekly, daily?
No. Anytime you have a flare, anytime you have an appointment. And I would say the times that I had crisis in any given year, I didn't go to the hospital less than 30 times a year.
Wow. 30 times?
Yes.
Wow. That's a lot of visits to the hospital.
So COVID,
before you carry on, how many hospital admissions have you had actually?
Uncountable.
Uncountable.
I cannot tell
Hundreds?
you. 50s? Oh no, not hundreds, but uncountable.
Wow.
Uncountable.
Okay. And then you can carry on with the COVID experience.
So with COVID, they made it clear that people with my illness are likely to die as soon as you get it. And in a way, I sort of believed it. So I was extremely frightened. I mean, I was completely paranoid. I could not do anything because if you look at all these drugs I take, imagine you've got COVID. How are they going to administer all those drugs?
Yeah.
They can't do it. So you'll be losing your drugs. They intubate you. You won't survive. So most people who had underlying problems, we genuinely believed it was a death sentence.
Wow.
And at this moment, my important appointments were cancelled. I had every appointment on the telephone, which was very inhumane because you don't know what's happening. You're not seeing your doctor's face. You're not talking to them.
And what about the regular blood test?
I went for them, but they will discuss with you over the phone.
Okay.
You know, because without your blood, they can't tell you how, especially with kidney disease, they needed to know. So they tell me, just wear your mask, go for the test and come back. But I never saw any doctors. But now, even for my possible transplant, one of the caveats they've said is, it is likely you can catch it. And if you do catch it, you know, you should know the consequences. But it puts you in a difficult situation, like, do you do it or not? And at the moment, I think if I was offered a transplant, I wouldn't want to do it in the winter months because of what happens
the risk,
in
the high risk.
Yes, but COVID has destroyed me. Today is the first time
you've been out.
I've left my house.
Fantastic, I know.
I mean, I was like a little child looking all around the streets when I was coming here. It was quite exciting.
Yeah.
But I've not left my house to any part of London.
For how many months?
6 or 7 months.
Wow.
I don't know what Marks and Spencer's looks like. I haven't been anywhere.
Because are you still shielding then?
You are supposed to, because they haven't told us. But if you look at the risk of COVID, I mean, it's just common sense. If you have this illness, you have to stay at home. You want to live. I mean, COVID will go. And I know people are skeptical about vaccines and things, but I have to tell you that for people who are extremely vulnerable, many of them are looking forward to a good vaccine. Because without a vaccine, I will be stuck in forever. And I don't want to be stuck in.
So would you encourage African people? Because I've been on a show before where
I think African people are very difficult to convince about vaccines. I have a lot of problems with conspiracies. I don't believe in them. You know why? For 27 years, the drugs I've used have worked.
They have worked,
If they hadn't worked, I wouldn't be here today. You understand me? So medicine works. You have to be able to risk yourself to know. People have always done research. Even as a lupus patient, one of the things I did was I always donated my blood for research because it wasn't an illness that was well known. If you don't give something, how will we get out well medically? So I'm sorry. If I have to take a vaccine to live, I'm going.
You're going for it. You're all up for it. I mean, you've been through so much already, so you must have incredible confidence in the National Health Service to believe everything. And I think for those of us here in the UK, it's the way to go, isn't it? And hopefully other parts of the world can join in. But as soon as a vaccine comes, I'm sure you are in, because it will be life-saving, isn't it? Definitely.
Anything that is life-saving is good.
Okay. So I think, is there anything you want to say for us to round off?
What I want to say is my faith in God has helped me fantastically.
Wow. Okay.
I was brought up a Catholic, but in the 90s I was introduced to Charismatic Church. And now I'm in the Methodist Church. But I believe God has held me to this point. There are many miraculous things that have happened in my life that are really God ordained. I don't play with God. And I just know He's done wonders for me. Fantastic. And I'm very grateful. I'm grateful to my friends. I'm grateful to my family. I'm grateful to Morgans. I'm grateful to Hobsons. I'm grateful
were
to
you
my
a Holy Child as well?
Yes, I was in Holy Child for sixth form.
For sixth form.
Yes.
Oh, I see.
And I'm grateful especially to my fantastic rheumatologist, who is one of the best in the world. Professor Eisenberg has looked after me.
Wow.
I mean, I can't sing his praises. I have been well looked after. And my surgery, my GPs, they never deny me anything. They give me every referral, every treatment. I've had the best of the best. And I can confidently say that despite my struggles, life is worth living. I have enjoyed my life. I have been blessed so much, and I continue to enjoy my life.
Wow, wonderful. Sister Amma Fulson, I can't thank you enough for making time to come and give us such a great insight. I'm sure so many people would have learned a lot from this session. If you have just joined in, because I have seen some of you are now joining in with questions, we cannot possibly keep going. We have been looking at lupus and how she has managed to live with it for over 20 years, nearly 30 years actually. Yeah. And she has gone through everything, including COVID. Yes. Yeah. And I know you were trying to find out, is this in place? Is that in place? And just making the effort and all of it. I said, we will make sure you are completely safe. So thank you so much for taking the time to come. Viewers, we are online through Omega Live TV on Facebook and on YouTube. So if you've missed any part of this session and of course of any of our other shows, please go back on Omega Live TV pages on Facebook and also through YouTube and watch all the programs again. You have been awesome. I'm sure there will be more questions to come. I will direct them your way because my knowledge in this department is very limited. Next time we come here, I have got Dr. Matilda Esan, who is a general practitioner based here in London, and we are going to take on another very important topic, fertility or infertility in men and women. I'm sure it will generate a lot of interest. Thank you, Morgans, for joining in. Hobsons, yes. Thank you to your husband. And of course to my husband as well for all the support. Oh, yes. Thank you to Omega Live TV and to all our presenters. We work here as a team, a fantastic team. Please share, like our page. I'll be sending you a lot of invitations. Subscribe to the channel, subscribe to the health channel, and keep going. Let's keep our people well informed. Yes. So who knows, we could be saving lives. Yes. So until I come your way again in 2 weeks time, it's been an awesome session. I'll give you a call tomorrow. You have been great, Sister Amma. Thank you very much. Thank you for watching, and please tune in again in 2 weeks time. I'm your host, Mrs. Winnie Ohene-Kissi. I've thoroughly enjoyed this session and I am looking forward to catching up with you again in 2 weeks time. Until then, stay safe. COVID is still around, and stay blessed. Look after yourselves.